Good afternoon. I'm George Latimer, Westchester County Executive, and we're happy to be here for a very important pronouncement on behalf of the mental health community that this month of May is Mental Health Awareness Month. I'm joined by the Chair of the Westchester County Board of Legislators, the Honorable Ben Boykin, our Commissioner for the Department of Community Mental Health, Michael Orth, and then also the Executive Director of NAMI Westchester, Sharon McCarthy, each of whom are going to be speaking as part of our program here today. After the press conference, there's going to be the screening of the film Resilience, the Biology of Stress and the Science of Hope. And then after the film, there'll be a debrief discussion on mental health awareness. And we invite everybody to stay, participate as is appropriate. We're joined by at least a couple of colleagues from the Westchester County Board of Legislators. I see Legislator Nancy Barr is with us. And I don't know if I'm missing any other obviously Legislator Kitley Koval is with us as well, and we may be joined by other legislators as we go along. We have a wide variety of other individuals from our executive branch. Our Commissioner of Department of Social Services, Kevin McGuire, is with us, and we have the head of our Youth Bureau, Dr. Damia Harris-Madden, is with us. Office for Women, Robbie Schlaff's Director of that office, is with us. Kick me, who am I missing? Have I missed any other key? I mean, there's other people who will have a chance to comment as we go forward. So, in any event, we certainly want to thank everybody who made this event possible today. And we're joined by several of Westchester's mental health agencies, quite a long list of them. And every one of these organizations is doing important work in the area of mental health. And I want to list all of them. There's quite a few of them. NAMI Westchester, Westchester Jewish Community Services, MHA, Mental Health Association of Westchester, Family Services of Westchester, the Guidance Center of Westchester is here. We have Human Development Services of Westchester, Family Ties of Westchester, St. Vincent's Hospital is represented here, the Harris Project, Search for Change, Student Assistance Services, New York Presbyterian Hospital, Four Winds Hospital, Phelps Northwell Hospital, and Rockland State Hospital. All of them represented as part of this effort. I want to commend the county departments. I've introduced a couple of the individuals so far, but to repeat, our Department of Community Mental Health, Department of Social Services, and the Office for Women, all of whom contribute to this particular effort. I'm very proud of the wonderful work that's being done by all of these people, and I take no personal credit for them. These departments of county government have been in existence for a while, have performed professionally. In fact, it's a source of pride that I can point out that the three department heads that I've introduced were all people who had served in that capacity before my administration. I had the good sense to keep them in their positions. But then also all of the different not-for-profit organizations that we've mentioned, each of which contribute a part to this mosaic. Very important. This is one of the few opportunities I get as a county executive, and Ben, as chairman of the board, also gets this opportunity to declare officially that the month of May is Mental Health Awareness Month in Westchester. You actually have an issue, make a note of it, with the Board of Legislators and the executive branch are in complete agreement. No disagreement. The importance of this, obviously, is about good mental health. There's a stigma that's attached to mental health needs, and I think we need to take that opportunity to promote wellness and resilience. You may notice the banner that's behind me. It's provided to us by NAMI of Westchester, and it's here with us today. It will be for the month of May. It'll hang in the main lobby here in this office building. And a digital version is also scrolling on the marquee out in front of the Westchester County Center. These banners are a very small token of thanks. Throughout this month, we want to pause and show appreciation to everyone who's working in this field and the need for greater awareness of the public and really to appreciate the effort that it takes to help further along the issues of the people that really do need our help. This is important to understand because, as I said a second ago, we all know this is a stigma attached to mental health issues that we need to wipe away as a society. It is a health issue, and a health issue no different than any physical issue that might happen to a person. When this news conference is over, there'll be a showing of the movie Resilience. It's a documentary film that delves into how adverse childhood experiences can be linked to destructive behavior and medical diseases that follow in the future. As the film will reveal, toxic stress, abuse, and neglect situations during childhood can trigger hormones that wreak havoc on the brains of children, putting them at greater risk for mental health illness, and then also triggering some of the other services of county government and sometimes leading to issues that deal with our Department of Corrections and our Department of Probation. There will be a question and answer period after this, which will be headed by Dr. Andy Bell, who's a program director at our Department of Community Mental Health. He has led the effort to infuse trauma-enforced practices throughout Westchester County. And as many of you as can stay for the film, we welcome you to do that. We think it's important for all of us to see this as best as we can. And I think this is part of what we want to do in highlighting this issue. So in proclaiming this month, I do so in joint effort with the Board of Legislators, and I'd like our chairman, Ben Boykin, to come and share some of his thoughts on this day. Ben.
Good afternoon, and thank you, County Executive Latimer. Yes, we're very pleased to declare this Mental Health Awareness Month in the County of Westchester, joining with the County Executive and all 17 members of the Board of Legislators. You've already been introduced to our 2 legislators that are currently with us. We may be joined by other Legislator Nancy Barr, who heads up our Environment, Health, and Energy Committee, and Legislator Kit Koval, who heads up our Legislation Committee and our Social Services Committee. So these are 2 very important committees that work with the issue of mental health. As you know, our Department of Social Services is our largest department in the county, roughly $665 million, but we spend a lot of money in the Department of Mental Health because mental health is a growing issue. It's not going away. And just as we see more and more issues relating to mental health, the stigmatization to that, we've got to be able to remove that. Just yesterday, the incident in North Carolina, my home state, UNC Charlotte, we don't know yet. Did that individual have a mental health situation? We don't know. So many other instances that have taken place in this nation, we missed the signs. So we've got to do a better job of finding out what those signs are and being able to address those signs before someone is injured or lose their lives. I know much about mental health, very up close and personal. Many of you know my youngest daughter is a doctor of psychology at the Kings County Hospital. She works in the Behavior Health Center there. She does testing, guidance, and treatment for toddlers through young adults. She sees it up close and personal. She knows the issues. She can't talk to me about it because of HIPAA, but she does say, Dad, if you knew what happened yesterday, you'd be really upset. And I says, well, don't tell me that. But also, some of the institutions that we mentioned here, New York Presbyterian Hospital, she did an internship there. St. Vincent, she did an internship there when she was going through getting her doctorate. So I know of these institutions and the value that they bring to the community of Westchester. So if you know someone that needs these services, please try to reach out to them in a very way that will not offend them, because we got to be caring about this. But we need to get the appropriate treatment for people that have these mental health situations going on. And this county is here to help. We have the experts here. Michael Orff is an expert in community mental health and all. So I'm very pleased to stand here representing the Board of Legislators as a partner with the County Executive declaring this Mental Health Awareness Month. Thank you very much.
Thank you very much, Mr. Chairman. Our next speaker is the Commissioner of the Department of Community Mental Health, Michael Orff. Michael.
Thank you, everyone. Thank you. I first want to thank the County Executive, the County Executive's Office, and the Board of Legislators and Chair for hosting this event. And thank you to all of you. It's kind of a reunion here with our colleagues and friends who we work so closely together, so thank you for being here. We are here today for a very important issue impacting our society, a public health issue that impacts each and every one of us, whether we're impacted directly, our family members, our loved ones, our colleagues, or even our neighbors. In fact, mental health has become a public health crisis across the U.S. and the world. A recent county survey confirms that mental health is the top health concern of Westchester County residents. And we all know that untreated mental health can result in people living in pain, suffering in silence, shattered lives, destroying families, and often lead to self-medication or other self-destructive behaviors. Untreated mental illness has a direct economic impact as well, including loss of work, productivity, and other significant costs to society, including school failure, eventual dropout, unemployment, domestic violence, potential incarceration, homelessness, and of course, premature death. As a nation, we have seen an increase in both children and adult mental health issues, people suffering from anxiety, depression, co-occurring issues, and of course attempted and completed suicides. In fact, we are seeing an impact on children as young as 3 to 4 years old, expelled from daycare, behavioral challenges that are being admitted to psychiatric hospitals, college-age students, seniors, and those who have served our country. We also see the impact on oppression, institutional structural racism, bullying, or other certain target populations that can lead to mental health issues and suicide attempts. We have also been enlightened by the seminal ACEs study and impact of adverse childhood experiences on the long-term mental and physical health, as R.C. mentioned, which we'll hear more about later in the film. Dr. Brock Chisholm, the first Director General of the World Health Organization, famously stated that without mental health, there can be no true physical health. It is in our best interest as a nation, as a state, and as a county to support and invest in the mental health of our residents. In Westchester, we're fortunate to have the leadership and support of our County Executive, George Latimer, and our Board of Legislators. They are sensitive to the issues of individuals and mental health needs and recognize the important service of our organizations in the room here today. My first encounter with County Executive Latimer was before he was County Executive, and it was at an HDSW, Human Development Services gathering of individuals in their program. And trust me, there was no media there, no fanfare, and he just strolled in, and he knew everyone's name. He engaged in a very sensitive dialogue. He cared about their well-being, and it was that connectedness that so many of our individuals and all of us strive for. So this has been a priority to our county executive way before he got the big job here in Westchester, and he has always been committed, as have our Board of Legislators, and Board of Legislative Kitley Koval is part of our mental health subcommittee, that they take the time to learn about the issues, and they set certain standards for our department and the organization, which we respect and value. We're also joined this afternoon by our colleagues from some of our most critical county departments, the Youth Bureau, DSS, Office for Women. Their partnership means so much in terms of helping the individual we serve, and we truly pride ourselves in our partnership. I traveled yesterday. I was at a mental health conference in Saratoga with other county mental health commissioners, and they were so envious of the relationships we have with our county departments and how we braid funding together, how we work together on a daily basis. It doesn't happen all over the country or New York State, so we really appreciate and value that partnership. And of course, we also have our mental health leadership with us this afternoon. We are so appreciative of the quality of services they provide and also the commitment and dedication of their staff. We thank you. And finally, I would like to recognize our DCMH staff and Community Service Board. Our Deputy Commissioner Joe Glazer was not able to be here today. He's up in Albany trying to get more resources for individuals with mental health issues who are incarcerated, another important area that the county executive mentioned. And finally, special thanks to NAMI of Westchester for their advocacy and partnering with our county in launching Mental Health Awareness Month. The responsibility to support our residents' mental health is a responsibility we all share, and that includes teachers, schools, faith-based, law enforcement, businesses, coaches, government, professionals, and of course families. In Westchester, we are proud to collaborate with our providers to offer educational and awareness programs such as mental health first aid, suicide prevention, CODA, co-occurring disorder awareness, trauma and resilience, so that we can all play a critical role in identifying, supporting, and connecting in children and families who may need help. By simply noticing someone is struggling and asking them, "How are you doing today? How can I help?" can be life-saving. And at the same time, it is important that our service system meet the needs of children and families who are impacted directly by mental illness. This includes timely access, effective treatment, choice, appropriate health care coverage, when and wherever that person may be in their point of life. This includes offering services in such settings as early childhood settings, Head Start, schools, health centers, or even when that person is facing legal involvement, incarceration, or reentry to community. It's essential we provide these mental health services where that person is at that point in time. Together, as a county, we have created cutting-edge programs and initiatives that have had a major impact, including our award-winning core program in Westchester County Jail, our nationally recognized early childhood and children's system of care, our crisis intervention training with our police department, suicide prevention and awareness task force, and we were recently one of only 3 counties that were asked to be part of a federal initiative doing a suicide fatality review process. And it was because of our partnerships, because of our medical examiner and Department of Health that we were given this opportunity. Our co-occurring system of care, recognizing the need for prevention, best practices, and integrated mental health substance use systems, our mental health court, our new crisis intervention team, our On Track program, which is a national model, and so many other programs and effective best practices. Our very own Pat White from DCMH, who will be receiving the What's Great in New York State, New York Mental Health Lifetime Achievement Award next week in Albany. So that's what's great in our state and our county. We have lots to be proud of in Westchester, yet the need is still great. In Westchester, we often refer to this work as a social justice movement. A social justice movement for those individuals who, as they and their families have shared with me, feel disenfranchised, ignored, marginalized, living in pain and isolation, silent, scared, confused, feeling helpless and hopeless, and not receiving the services often that they need. These individuals can be any one of us in the room, or loved ones, or colleagues, or neighbors. As Commissioner of DCMH, I am proud of our strong partnership with our departments and agencies and a true commitment in treating individuals with respect, with dignity, and provide a system of care that is both welcoming, hopeful, and recognizes the various complex needs and issues that may be experiencing and provide the best quality services possible. Today, we are launching our mental health, May is Mental Health Awareness Month for Westchester. We have an entire month of educational programs and forums bringing awareness to mental health, including Youth Mental Health First Aid, movies throughout the county, Myra Alfred's Roundtable, and listen to this, DCMH, we just got into the Twitter age, so we're sending out a tweet a day, thanks to that, and we have the information packets in the back here today for all those events. Let's make sure mental health awareness is not only a monthly or seasonal event, but something that's in our daily conscious and our actions. I want to thank you all for being here, and it's my pleasure to introduce Sharon McCarthy from NAMI.
So I want to thank County Exec and the legislature for recognizing Mental Health Awareness Month. Mental health awareness is what we do every day at NAMI Westchester, helping families and those with mental health conditions through education, support, and resources is an important part of our mission. Over the past few years, we've expanded this to make community education a priority. Through our presentation programs in schools, colleges, community and youth organizations, businesses, and house of worships, we've been able to provide residents with the knowledge and support they need to help others and, more importantly, save lives. This past year, our presentation program has reached close to 10,000 youth and adults in providing education. Suicide is the 10th leading cause of death in the U.S. and the second leading cause of death in ages 10 to 34. The only way we're going to bring those statistics down is through awareness and knowledge. During the month of May, you will see many signs of support for mental health. The exterior of the Beeline buses will feature NAMI Westchester information. The NAMI ribbons are being hung up around all the towns and villages. Earlier today, we had a ribbon cutting in Yonkers, and we have multiple community presentations scheduled this month. We all have mental health. It's incumbent upon all of us to learn about and support mental health. Please join us at our major awareness event, the 7th annual NAMI Walks Westchester on Saturday, May 18th at Rydtown Park at 8:30 a.m. Thank you.
And may I just say to Sharon and the organization and all of the organizations here that are not-for-profits, it's very important to understand something. You'll hear a lot about public-private partnerships, and we generally think of those as corporate entities that contract with government to do some type of a service. And the general rhetoric around them is that the corporation, because it's for-profit, operates in a more efficient way and produces a result that could not be done by government. Therefore, the need for public-private partnerships. Every time you hear that as a definition, you need to expand it to include a similar relationship between governments and nonprofit organizations. The fact that an organization is nonprofit does not mean that they're not professional at what they do. And when government contracts with a business, it is the same thing that we do when we contract with a not-for-profit. We are saying that that not-for-profit organization can provide a service better than the government structure can. It exists already. And so for NAMI and every other organization represented here and outside of that, it's the same basic structure. We look to try to accomplish an end result in the communities that we're responsible for. And that involves the activity of government, and it involves the activity of business, but it also involves the activity of not-for-profits. So for those of you who are here who represent not-for-profit organizations, this administration views your contribution in the solving of these problems to be as absolutely essential as any other contribution. So thank you for what you've done on behalf of you and your organization. And that was a round of applause. So we're going to see next the film that we mentioned, Resilience, the Biology of Stress and the Science of Hope. I'm going to ask Dr. Andy Bell to get up close and personal because we're going to need him to lead the question and answers as soon as the film is over with. So, Andy, if you want to sit up close and personal, and I guess we'll get the room ready for the film.